So without much further ado, thank you, Minister.
Thank you very much, ladies and gentlemen of the media. Let me welcome, I think, amongst us, let me welcome Dr. Kalua, who's representing WHO as our country director, and also the MEC for Gauteng, Dr. Bandile Masuku, and of course, Acting Director General, Dr. Anban Pillay, and the heads of National Health Laboratory Services and National Institute for Communicable Diseases, and other officials amongst us here. I'd like to begin by indicating, and thank you for attending. We want to indicate that the last time we gave a briefing, we were indicating that we would like to stay very closely in contact to be able to share whatever new developments, and also just to be able to find out what you've got from your side so that we can try and compare notes to make sure that South Africans are kept very well informed about the situation on the coronavirus infection. Therefore, I would like to begin by welcoming the declaration of the World Health Organization that the coronavirus has become a public health emergency of international concern. This sets in motion an enabling framework to ensure that there is a concerted multinational collaboration to detect, to contain, and to stop the spread of the coronavirus. We accept the WHO recommendation and will tailor those recommendations within our specific needs of our own country. But it offers quick guidance in terms of what our attitudes have to be in relation to managing this infection. So I want to start by reassuring South Africans that to date there is no confirmed case of coronavirus in South Africa. If there was any, we would have been able to do that ourselves, and because we've got the facilities to be able to confirm such a diagnosis. We've remained vigilant on the developments regarding the movements and behavior of the viral infection across the world, and we continue to engage international academic fraternity to better understand how this virus behaves and its health effects. So to recap, the WHO first became aware of the respiratory disease of unknown cause in Wuhan City, 31st December, and on the 7th of January 2020, the causative pathogen was identified as a novel coronavirus, which is 2019 nCoV. The virus is believed to have originated from animals, which we call zoonotic origin. The incubation period is currently estimated to be up to about 14 days. More evidence is needed to determine whether any asymptomatic carrier may contaminate another person or not. Symptoms are non-specific to the virus itself and include fever, cough, runny nose, and sneezing. Occasionally, the virus can cause complications of shortness of breath, multi-organ failure, and death. The evidence increasingly supports the theory that those who are most at risk are patients who have got some kind of immune deficiency, whether this would be due to age or a pre-existing comorbidity. There is no specific antiviral treatment for this one, and the treatment remains supportive. So we treat you on the symptoms on the basis of which the patient will be presenting. There is also no vaccine at this point. There is no evidence that the virus that is infecting humans has mutated since it was first discovered in humans. Yesterday, I convened a high-level interministerial meeting ahead of the WHO meeting in anticipation of the announcement of public health emergency of international concern. The ministers of tourism, police, state security, home affairs, defense, international relations and cooperation were all represented at the meeting and were joined by the Department of Health and NICD officials. This meeting sought to brief the ministers and ultimately the President and Cabinet in detail on the status of the coronavirus spread and to ensure that we are prepared in all spheres to prevent the entry of coronavirus into the country, and should there be a case detected, to respond speedily and appropriately to that eventuality. In the last press briefing, I'd also outlined the process of activating the Emergency Operations Center should there be a public health emergency declaration by WHO. While that Emergency Operations Center was activated last night and is now currently operational. We're busy building up the staff numbers that we need to be able to do that. But from last night, activities have started. This now means that we have dedicated staff working exclusively on coronavirus, monitoring and responding to all reports that they will proactively detect and follow up. There will be added personnel and resources, although we had already capacitated ourselves for this eventuality, so we would not find ourselves wanting. This Emergency Operations Center is in constant communication with all the relevant stakeholders and provinces. The multi-sectoral National Outbreak Response Team will reconvene straight after this press briefing at 9 to revise the standard operating procedures in response to WHO announcement. This is a team of officials from various departments who are relevant in this matter, various specialists and researchers and everyone who is involved in this. They therefore will be convening now, and they'll be giving us guidelines and respond to situations as it develops on a hour-to-hour basis as the situation will require. We've published a list of dedicated centers for isolation and treatment of people who are infected with the coronavirus. In Limpopo, we've got Polokwane Hospital. In Mpumalanga, Rob Ferreira. Gauteng is Charlotte Maclege, Steve Biko, Tembisa Hospitals. KwaZulu-Natal is Grace Hospital. Northwest is Clarksdorp Hospital. Free State is Pelonomi. Northern Cape is Kimberley. Eastern Cape is Livingston Hospital. Western Cape is Tygerberg. These centers have been chosen for their ability to isolate, manage, and contain and conduct research on suspected or confirmed cases of coronavirus. This by no means suggests that the other facilities do not have the ability to manage a suspected case that presents for the first time. It is simply a mechanism to ensure that we can centralize coordination and data collection. So every hospital should be able to manage it and then move them on to where we'll treat them centrally. A 24-hour hotline for clinicians that is run by NICD continues to receive a large volume of calls, which is a good sign of high vigilance amongst our healthcare workers. And you'll understand that when you have a situation of this nature, even ordinary flu is treated with suspicion. So we actually expect that just out of vigilance, the numbers of people who are calling is going to be increasing. And we believe that is better. It's better to always over-suspect than to under-diagnose. The National Health Laboratory Services is available for 24 hours a day to test for coronavirus. So at any time of the day, the test will now be done. Port Health Service remains responsible for the previous, is responsible for the preventing, protection and providing a public health response by monitoring the points of entry. Port Health is also responsible for early detection of suspect cases through implementation of screening measures and responses to suspect the case. Port Health Services also are provided in South African ports of entry with staff complement of about 300. Apart from digital thermal screeners, Port Health officials have also been provided with additional handheld thermometers to detect the temperature of any traveler arriving into the country. We have also requested the support of the South African Military Health Services to work with us so that we can actually reinforce manpower in the various ports of entry where we believe that we need additional support. And so that is actually going to be mobilized as early as today. Screening is conducted in the ports of entry to early detect an ill traveler through one temperature screening that is conducted in 36 points of entry utilizing non-invasive thermometers, where all travelers arriving through the ports of entry are channeled to the temperature screening. If a traveler is found to have an elevated temperature, they are assessed by a nurse and if determined to be suspect, the case then they will be safely transported to a health facility for further management. 2, arriving conveyances. The health officials will go on board each arriving international aircraft and ship to determine if there is any sick traveler. If a traveler falls sick whilst on board, port health officials are informed by the crew members in line with the World Health Organization and the International Civil Aviation Organization requirements, and an assessment of the traveler is conducted upon arrival. This is standard, but we want to just confirm that this has been reactivated, and therefore we are on higher alert this time around. If the traveler is found to exhibit symptoms consistent with the novel coronavirus, the traveler would then be safely transported to a medical facility for further management. Contact tracing of travelers who may have been in proximity of a suspect traveler would be conducted to ensure those individuals are identified and investigated thoroughly. Thirdly, as the busiest airport in Africa, special measures have been introduced in OR Tambo International Airport, where travelers on direct aircraft from China and have traveled to Wuhan in the past 14 days are required to complete questionnaire for possible contact tracing. 100% of arriving travelers were screened in all high-risk airports since the onset of the outbreak. A total of 55 travelers were found to have elevated temperature and referred to the nurse for further assessments. Of the 55, 14 were from China, 1 from Thailand, 40 were from non-endemic countries. But no traveler were found to have symptoms consistent with the current novel coronavirus, and none of them required isolation. So the work of screening basically just picks up anyone that is suspicious until we are sure that we've been able to confirm the absence of the infection. Then, of course, thereafter we release the individual to proceed. WHO has developed and shared interim guidance for laboratory diagnosis, clinical management, infection prevention and control, home care for mildly ill patients, risk communication and community engagement. Countries including South Africa are using these guidance documents to revise national preparedness plans. WHO is also working with networks of researchers and other experts to coordinate global work on surveillance, epidemiology, modeling diagnostics, clinical care and treatment, and other ways to identify, manage and limit onwards transmission of the disease. Work has commenced to develop a vaccine as soon as possible. The National Institute of Communicable Diseases and the National Health Laboratory Services remain the center of technical expertise. In the past 24 hours, 14 samples have been submitted to us for investigation for coronavirus. They all tested negative. In regard to movement, trade, we remain guided by the WHO, which has maintained its recommendation that there should be there should not be no restrictions on travel and trade. Further, we wish to echo the sentiments of the Director General of the WHO that we are very confident in China's ability to manage the public health emergency effectively, and that our citizens living in China, Hubei province and Wuhan are in safe hands. Consequently, we maintain that there is no evidence to support repatriation or emergency evacuations of our citizens. At this stage, there is no report of any South African citizen who has contracted the infection. We are aware of two South Africans who are currently under a 14-day quarantine in Tianjin. They'd moved from Wuhan city to Tianjin, a neighboring municipality. But that's, as far as we understand, is basically just to ensure that people are under observation for a period before they actually can proceed to other areas. DIRCO has established a 24-hour hotline for all South African citizens living in Wuhan city to contact the South African Embassy in China. We will share this so that the media can also publish it, so that if you know of anyone who needs to contact the embassy, they've got an alternative line which they can use. This will actually help us to be able to improve our communication with a lot of South Africans who are in the area. The information is on the DIRCO website as well as on social media pages. We've also requested that all departments and provinces must provide us a database of students and staff that are in China. Some of the provinces have already indicated that they've got a number of students in these different parts of China, and some, in fact, have indicated the total data they know to be in Wuhan, and others in various other provinces. We did consider the full ramifications of repatriation or emergency evacuation, and realize that it's very much an exercise of weighing up the risks versus the benefits. So we'll continue to monitor the situation on a day-by-day basis, and then we'll always respond as we think that it's appropriate at that time. What remains a key principle is limiting the movement. The more we move people around, the more we enable the spread. We are very sensitive to the anxieties of South African citizens and their families, and also wish to assure them that we are very much prepared to respond appropriately as the situation develops. I think with the kind of reports that are coming all over the world, there are many people who have got a lot of concerns, and therefore we need to really work together to try and manage their concerns, and also manage what is best for both those who are involved in the particular parts of Wuhan and Hubei provinces, as well as what the public health requirements would be. I therefore would like to thank and applaud the Ministry of DIRCO that has been extremely positive on the situation in China. What DIRCO has established is that there is an estimated 165 students and 54 teachers living in Wuhan, and approximately 3,000 students living in China. So when we get all the information from the various departments and provinces, we'll be able to update this number. We'd like to encourage all South Africans to ensure that they register their presence with the South African missions in China, so that it's easy for us to be able to track them, and also to make sure that when we need to send them information, we know exactly where to find them. Currently, a strict 14-day quarantine has been imposed in Wuhan, and that is if you enter Wuhan despite the virtual complete shutdown of public transport, you need to stay there for about 14 days before you can leave, or if you intend to leave, you need to await 14 days before you can do this. This is just to ensure that there is in-house observation for early detection of signs or symptoms that may develop. The Chinese authorities have assured us that there is food security for those people locked up in Wuhan, as logistics and food supply have not been shut down. And this, we have been picking up this debate because DIRCO has been communicating to just always try and act to allay the fears of anyone that raises issues from the side of any South Africans who are in China. The Chinese ambassador has also indicated that China has developed a new detection device specifically for coronavirus, and should South Africa need, they said they can make some available. So immediately after this meeting, the Chinese ambassador will actually come with the relevant information and the relevant individuals, and our team here is on standby to evaluate whether in fact this is something that we can take advantage of, but that's really going to be left to the clinical experts to be able to give us a sense of to whether there's any additional advantage of using that device. Both DIRCO and the Department of Health are in continuous contact with the South African Embassy in Beijing and Chinese embassies in Pretoria. So we always try now to compare notes to make sure that we all have the same kind of information. The announcement of the public health emergency should therefore bring comfort and reassurance that the coronavirus is receiving the most urgent attention by the international community, and that everything is being done to protect the global citizens. It should not necessarily set up a fresh wave of panic. We are aware that as of last night, the numbers of cases that has been reported outside China has increased. I think the last figure that we're given was 90, and as I said, I don't want to be quoted on the figure because we are aware that the figures keep changing, but we are aware that various actions are being taken by specific countries to deal with those that they've detected in their own countries. But the existence in about 3 or 4 countries of human-to-human transmission is actually the basis on which the WHO has declared coronavirus public health emergency of international concern. And therefore, what is most important also for the various countries is also to find ways to contain the spread of the infection now in their country, because they almost become an epicenter of the infection if no precautions are taken to limit the spread. So our teams today are going to be working on further additional activities that will need to be taken into account should there be any situation arising that will require us to act beyond this point. We have still not received any case, any suspicious case, or even any confirmed case. But we're going to be ready even for, in our situation, to be able to manage should there be a confirmed case or should there be any suspicious case that might be landing on our shores. So that preparedness for us is basically what we think is important at this point. We are also aware that there are several countries have been sending aircrafts and also evacuating their citizens. We believe that these are decisions that countries take on the basis of concrete information that they have on their hands. In our case, we do not have a particular South African anywhere that would have either landed into South Africa or they're staying in China that has tested positive for the virus, and that's a reality from which we're going to be operating. So we keep taking all these precautions and also are trying to do our best to make sure that if there should be anyone that lands into the country, we are able to detect as much as possible. We've also heard that there are reports of individuals who might be on their way coming to South Africa. Again, when we get enough information, we'll be able to know how to assist and support and deal with those particular cases. Right now, we do not have adequate information to deal with that. We remain committed to the protection of South Africans, both here and abroad, and therefore will continue to closely monitor the developments around the issue of the coronavirus. I must also just indicate that out of concern, I was actually supposed to have flown out to Thailand last night to join the conference on the national health insurance. But considering that there were these developments, it was agreed with the President that we actually need a full team here to be on an alert, so that we must be able to respond and support South Africans wherever the situation arises. So everything is being done, and we have been able to brief Cabinet and Lekgotla yesterday. We're going to be giving President continuous briefing from last night. We're doing exactly the same. So we just want to indicate that we're ready. We want to also invite you as members of the media. If you've got any information, please share with us so that you can see what is it that needs to be done. We're also analyzing some of the cancellation of some of the traveling the aircrafts into China, because we want to just check which of those countries already have imported cases from China, and so we're going to be looking at that kind of information so that we are able to understand the situation better. There are students who were on holiday who have been who needed to go back to Wuhan and other parts of China, and we have agreed with the Chinese embassy that those such students should delay their return to China. We don't think that there's a kind of emergency that can't be managed in this case, so we would like to just encourage them to wait until there's further announcements, so that we can just manage people who are within the situation. So, ladies and gentlemen, this is where we are at this point, and I would really like that we allow Dr. Kalua to give us a few comments from the WHO, seeing that we received the statement from Dr. Tedros Ghebreyesus yesterday. I actually have happened to have had a consultation and had a discussion with the Director General of WHO yesterday in the morning. So as we're making all the preparations, we had actually full and direct guidance, and we had a better sense of the situation based on his visit to Shanghai and his meeting with the President Xi Jinping, so that we had as much information as possible, as necessary, for us to be able to take the kind of steps that we are taking. As I said, we continue to update our information, and therefore will respond as the situation arises. We do understand that the situation is rapidly developing, and the numbers of infected cases has moved from the last time we were saying 4,000, yesterday we were saying about 6,000. I think the figure is going up to about 7,000 now. So all of those issues are consideration that we have to take into account each time as we respond to the situation. Thank you very much, ladies and gentlemen. We would like to invite Dr. Kalua to come and make his comments.
Thank you very much, Honorable Minister. And just also to recognize the Acting Director General for the National Department of Health, the MEC for Health for Gauteng, and other technical experts who are here, and the media present here. My statement will be fairly brief, because the Honourable Minister has covered most of the areas that need to be covered, and also has alluded to some of the important statements that were made as the Director General of WHO declared the coronavirus outbreak as a public health emergency of international concern. And as you are aware by now that the situation is evolving, that every time we are having new cases being confirmed, and we are having, every time we are also having other countries reporting cases, confirmed cases of the coronavirus. And because of the evolving situation, WHO was able yesterday to declare public health emergency of international concern, meaning therefore that this has become a problem that required concerted international efforts in order to address it and to stop further spread, calling upon countries to strengthen their ability to detect, rapidly manage and contain any cases or outbreak that appear, so that there's no further spread beyond the borders of other countries, so we're able to deal with this situation. So basically, the work that has been initiated here, what the Honourable Minister has described, is very much in line with the calling of this as a public health emergency of international concern, requiring all aspects of government and all partners to work together in order to address the situation. In South Africa here, there's no confirmed case of coronavirus. The most important thing now is to strengthen our ability to detect and to contain rapidly, if at all we get any potential cases. So, Honourable Minister, just to thank you for calling this press briefing, and also for bringing to the fore the importance of this outbreak, because an informed public is an important asset in the prevention and management of any outbreak. So the role of the media, which is well informed, and the public that is well informed on the facts of any outbreak, is of utmost importance. So thanks very much, Honourable Minister, for this press briefing and for asking me to make a few statements. Thank you.
Thank you.
They will proceed straight to the Q&A session. If I can just introduce the entire panel before we go there, and I'll take batches of 5 questions. Of course, the Minister and Dr. Kalua have been introduced. On the right of the Minister is Professor Cheryl Cohen, who is at the NICD. To the right of Professor Cheryl Cohen is Dr. outbreak from the Department of Health. To the right of Dr. Chile is Professor Suka from the DOCO. And next to Dr. Kalua is Professor MEC of Health in Gauteng, and then to the extreme left is Dr. Kalua from the NICD. So you do have a very, very expert panel and questions. 5 questions.